17th, 2020. I'm Brian Wheeler from Mono County Public Health, and tonight we have a lot of our normal panels, a lot of our normal faces, but we also have a special guest panelist tonight that we'll get to in just a little bit. But first, we'll turn it over to Stu so Stu can give us our update.
Welcome. Thank you, Brian. Good evening, panelists. We have a lot to get to, as we always do on our community conversations. Believe it or not, this is December 17th, 2020. So let's get right to it. Welcome to all our Spanish speakers. Once again, thank you for joining us this evening. If you'd like to listen to this conversation in Spanish, you can follow those easy steps. Really, all you need to do is click on the interpretation icon on your login screen. You can also watch the meeting live, and this is for everybody as well, on the Mono County Health Department Facebook event page. We also have our wonderful translators with us this evening. So again, I'm going to just take a few pauses after each slide. And again, just for our presenters, just be mindful of our amazing translators. Thank you. Mountain View Fire resources, again, all the information and more can be found on the Mountain View Fire Incident Portal. The website there is on your screen. And for updated information and resources, we direct you to the Mountain View Fire Resources and Recovery Facebook page. Justin are doing an amazing job up there at Walker, looking after our many residents, those affected by the fire. This winter, we need everyone's help to do everything we can to keep our friends, families, neighbors, and visitors safe. We all need to do our part to stop the surge and to stay safe, to stay open. These are all the various communication flyers, materials, posters, social media posts that we've collected and we're sharing with our community. You can see we have Stop the Surge, Did You Know? And again, you've all seen our Stay Safe to Stay Open winter graphics. We're going to get right to the case stats. Again, all this information is available on the Mono County COVID-19 portal. Just look for the icon that says case stats. As of today, and this changes in real time, 488 cases. You can see you've broken it down by region, 383 in Mammoth Lakes, 69 in Northern County, and 34 in South and East County. These are the metrics over the last 30 days. You can see we've seeing a significant increase, unfortunately, of upwards of 108% over a 30-day period, or 254 positive cases, essentially from the beginning of through mid-November through mid-December. These are the 7-day metrics. We pull these just to show how we're doing on a closer or a more narrower window of our cases. You can see here we've tested 436. We've had 88 positives with a positivity rate of 20%. So that's 1 in 5 people are positive from testing throughout the county in Mammoth Lakes, North County. So again, very alarming numbers, and we'll talk more about that this evening and the ramifications to Mono County. These are the health stats provided by Public Health. This shows you the positivity rate by week and the and the positive cases for a 4-week period. You can see here we've gone from 2.2% on the lower left-hand corner there in October, and it said we're eclipsing now up to upwards of 20% in our positivity rate. And you can see here, this is a graph that's going clearly in the wrong direction, 13 cases up to just under 100. And you can see here, there's a graph that shows you the escalating positivity rate, the case count. And Dr. Burrows is here this evening. He'll talk more about the hospital status and the impacts to the Mammoth Hospital if these escalations continue. The regional stay-at-home order is in effect. I believe everybody's familiar with this order. It will be in effect for a minimum of 3 weeks. It will be lifted when the regional available adult ICU bed capacity is greater than or equal to 15% for a 4-week period. At the end of the stay-at-home period, each county within the region will be assigned to a tier based on the blueprint for a safer economy. We transitioned from purple into the regional stay-at-home order, and more than likely will transition back into purple after the regional stay-at-home order is rescinded. This slide here just shows you the current ICU capacity across the state and the various regions. paying particular attention to Southern California region, which is where Mammoth with Mono County resides. You can see the current ICU capacity is at a 0%. The statewide is at 3%, so very dire situations across the state. All this information is available on the COVID-19ca.gov website. We've shared with you a lot of information about what's open, what's closed on the regional stay-at-home order. It is available on the portal. These are just the highlights of kind of what businesses have to be modified. That includes outdoor recreation. You can see retail. You can see hotels and lodging, which is under the Mono County lodging order. You can also see restaurants are only for takeout or pickup. And you can see places of worship as we get into the holiday festive season is for outdoor services only. Regional stay-at-home order is in effect, and that includes a clarifying order published by the health officer that applies to all short-term lodging operators from hotel, motel, inclusive of private residences as Airbnb, VRBO, and so forth. All short-term lodging facilities are subject to this order. You may remain open for those purposes on the bottom of the slide for COVID-19 mitigation containment, to house essential workers, and for persons who are displaced due to loss of homes from fires. The order also clarifies that there is no renting or leasing for leisure or vacation travel. We've made that clear. If there's any question or uncertainty, there is a process that you can follow whereby a written determination or directive from the Unified Command Emergency Operations Center, the county health officer, and it's also being run right now through the Town of Mammoth Lakes Finance Department. That form is under business resources on the COVID-19 portal. And again, if you're a property owner, you can certainly visit your unit. But again, we just want to remind you that it's really primarily for maintenance repairs and to keep your members of your condominium home to those immediate household or those living with you in your primary residence. Travel advisory was updated on November 30. Again, the state is requesting that you stay within your county and to not drive more than 2 to 3 hours. If you are traveling from other states or you've recently returning to California, you should practice self-quarantine for 14 days upon arrival. Again, this information is available on the website at the bottom of the slide. A couple of travel definitions. We're hearing this on our COVID helpline. We get these on our calls. Some questions regarding what is non-essential, what is essential. Here you can kind of see those definitions. It's provided by the state. Non-essential is essentially tourism or recreational in nature. And you can see essential travel includes work, study, critical infrastructure, economic, supply chains, health, immediate medical care, and safety and security. So very well defined. We have updated the business resource page. This is on the COVID-19 portal. Again, for all our business members, communities across the county and in the town of Mammoth Lakes. Information on the newsletter, on the path forward, on testing information, what's open, what's closed, where to find that information about the transient rentals. That's under forms. All the flyers are in there as well. All the employee assistance programs and all the many business assistance programs that are now available to those businesses are on this page. These programs include what we're calling the Mammoth Lakes Community First programs. There's an additional $250,000 available, and that is being run through Mammoth Lakes Housing. You can see the website there at the top of the screen. We've also contributed money to the Right to Recover program and providing support for the Amaka-run food bank. The round 4 of the business assistance programs, $400,000 available for Town of Mammoth Lakes businesses. You can apply for grants up to $20,000. Applications close Tuesday, December 22nd. So that's very quick. So please get to this form, access the form online at the website at the bottom. And funds are planned to be distributed by the end of December. County Assistance Program, round 3 of Mono Cure, $30,000 is available. You can see priority will go to businesses that did not receive PPP or EIDL. All businesses are welcome to apply. Awards would not exceed $5,000 per business. And again, very fast program. We want to get this money to all our businesses in need. These applications are due Monday, December 21st, 5 p.m. You can see the website to apply or call Jeff and Alicia on the 800 number. Food bank, I know we're getting a lot of information on, or a lot of questions on the food bank. We recently wrapped one up this week. The next food bank is scheduled for January 5th and the 19th. That's on Mammoth Lakes Main Street. It's behind the promenade there. Recipients will need to fill out a marker paperwork as sort of a check-in, and it will be a drive-through. Information is available there by calling a marker at 760-279-4350. If anyone's looking to make a donation, you can through Mammoth Lakes Chamber. COVID testing for the week of December 21st. Again, all this information is on the portal. We'll have testing Monday, Mammoth Lakes, Monday in Antelope Valley, Tuesday in Mammoth Lakes at Sierra Star, Wednesday at the Community Center, and Saturday and Sunday, the tribal community is providing testing in Bridgeport. Again, just look for the icon there at the top of the screen of your portal, and you can see the website address there as well. We just want to provide a quick update on COVID-19 vaccine. Brian tells me that we're getting a lot of calls through the health department. This information is on the public health website. We're also going to provide this information and more on the Mono County COVID-19 portal. So please be patient with you. A lot of information is becoming available. So again, we provide as much as we can when we can. Look for this information here on our portal. As we said, there's a frequently asked questions document. A lot of information available there. So I would direct you to the website at the bottom of the screen to access the frequently asked questions document, but we'll certainly take as many questions as we can this evening. And I'm sure Brian and the team will try and give you as many answers as they can at this time. You can see here, Vaccinate Mono is kind of our campaign for the vaccination program. Brian just wanted to provide a little information here to the public of, you know, what phases are rolling out and when, who's going to get the first shots and so forth. We're in really kind of what they call phase 1A and 1B. Again, Brian and Dr. Boo will provide more information tonight. But again, they're really just focusing on healthcare, highest risk, and then as more vaccine becomes available, we'll be working through the larger population. Next bilingual community conversation is Tuesday, January 7th. So look for that on the portal. Again, we send out a lot of information on Facebook and our many channels that you can see here. Our website in English and Spanish. We have a wonderful COVID-19 help. Town of Mammoth Lake short-term rental hotline, code compliance, Mono County code violations emails. And again, if you're not signed up to receive the Mono County COVID newsletter, please subscribe online right there at the website address at the bottom of the page. And that is every Tuesday and Friday. So here we have a new section we're calling the Faces of COVID. We'd like to introduce Greg Garfield to the conversation this evening. He's going to join us throughout the conversation. And Greg is here to really share his story firsthand with you because he wants to keep everybody safe. He wants to talk about his journey that he took, 64 days in hospital, 31 of those on a ventilator. And when I watched that video today, I was profoundly impressed with what Greg went through and how he came out on the other side as positive as ever. But what really kind of resonated with me is, hey, we really got to knuckle down and just do what needs to be done. So with that, Greg, I'd like to welcome you to the panel this evening in our community conversation. And thanks again for joining us.
Sure, thanks again for having me. And for the town of Mammoth Lakes, I just want to thank each and every one of you. Mammoth is so near and dear to my heart. You know, I learned how to ski here when I was 13 years old. I've owned property here, my home here for 20 years. It wasn't expected to what happened this past year. You know, I usually go on a ski trip every year, a European ski trip, which this particular year was in Val Gardena, Italy. And 3 days into skiing, I started getting flu-like symptoms. Just prior to that, my now fiance, AJ, calls me and says, are you aware of this thing called the coronavirus? And it's in Northern Italy. Where are you? And I said, Northern Italy. And, you know, we really didn't know anything about it and what have you. I ended up, getting flu-like symptoms. I have what you call a hyperimmune system. It's the best of the best. Every 24 to 48 hours when I get sick, I get better. I had no pre-existing conditions, and I really wasn't healing from this. So we were 3 days prior to leaving the trip. We had three guys on the trip. There was 13 of us in total. 3 guys were from Switzerland. They left early. One of the guys went to the hospital back in Switzerland and actually got sent home with the flu. So we, all thought we had the flu. And on the plane flying home, I got a text. One of the guys that was supposed to make the flight ended up checking into the hospital in Munich with double pneumonia, and he was tested positive for COVID. So when I landed in LA, I got home, quarantined myself, reached out to AJ. Again, we didn't see each other. This was on March 1st. It was very early in the pandemic. Jump ahead to March 4th. I ended up just gurgling in my own lungs, was talking with a buddy of mine who got a mutual friend of ours that was a doctor on the phone. And he ended up reaching out to a bunch of hospitals, none of which would take me except for St. Joe's Hospital in Burbank. And I ended up on March 5th at 5 o'clock in the morning being admitted to the hospital there as patient 0. I was one of the first patients in California to actually get COVID. On March 7th, I had to be intubated on a ventilator. And 31 days on a ventilator, 64 days in a hospital, I had a 1% chance of survival. And this past Friday, which I was released May 8th from the hospital, and this past Friday was my first day back on skis. And as amazing as that was, what had happened on that 31 days on a ventilator, I had everything under the sun thrown at me. I had sepsis, I had MRSA, I had 4 collapsed lungs. I was put on something they call pressors that every time, for the 4 different times when I was moved even an inch, my blood pressure would collapse. And it was something, a drug called Levophed that I was put on that forced all the blood to my vital organs. And what ended up happening was it compromised my extremities. And I unfortunately lost all my fingers on my right hand. I lost half of my fingers on my left hand and the tips of 3 of my toes on my right foot. And given a 1% chance of survival. And, medically speaking, I shouldn't be here today. And I'm so thankful for all the love and support that was given to me. It's really a heartfelt thing for me to talk to you guys today, to really explain just how real this virus is. And we're having the biggest spikes, even back in April that happened. It's worse than that, than there. And today I'm telling you now, this is for real. And anybody that has any skepticism whatsoever, I'm here to tell you, given a 1% chance of survival, it's actually less than that. And that being when you have 40% of individuals that are asymptomatic, 12% get sent to the hospital, 1% is critical, and I'm the 1% that survived of the 1%, which means most likely that those individuals would not make it. So I'm here to tell you that we need to do what it takes to get in front of this. And we're on the last stretch. We have the vaccine. There's a lot of people that aren't confident of it. There's some people that are. That's great. But we're here at the end, at the last hour of this. We have to take the responsibility to wear a mask, to stay socially distant, to do what it takes to be responsible as an individual. It's not political today. It's not political ever. I don't care if you're to the right, to the left, or dead center. We have a responsibility to being an individual to get ahead of this thing. And even in a small community that, we just need to live. We have to have the ability to get back to how comfortable we all are. And I'm here today to tell you that I'm not a victim. I'm a survivor. And I'm here to give you hope that the worst of the worst can still be the best. So if there's anybody that has any questions, I'm here for you.
Greg, thank you so much for being here with us. Yours is an amazing story.
Thanks,
Absolutely. So why don't we jump into some of those questions? Can we have our first question?
A filming company has been shooting at June and Mammoth Mountain this past week. Is this considered essential work?
I can take that.
All right, go ahead, Rob.
Yeah, so there is a
Sorry, guys.
filming companies are on the list of essential workers. My team, as folks know, we have a form that people have to submit in order to authenticate their essential status. In addition to just being in that particular realm, they have to indicate exactly what projects that they're going to be working on in town, and we confirm and verify the legitimacy of those projects. So filming crews is on the essential workers list. My team spent a lot of time on that particular one, walking through, and those folks are housed at different places here in town, but they're all legitimate visits.
Thank you, Rob. Let's go to our next question, please.
My housekeeper told me today that she and her cohorts are having to clean condos several times per week between renters. She and her cohorts are alarmed. What is the town able to do to monitor these illegal rentals and take appropriate actions?
So I'll take that one as well.
I was going to say right back to you, Rob.
Yeah. So we've what we initially did the first week of this, when the order came into place, is we mailed out a letter to all business tax certificate holders that operate short-term rentals, all operators, basically explaining to them, that we did have an ordinance in town that restricted the lodging to essential travelers at this point in time, and really what the details behind that were, what the expectations of the town. So we spent the first week communicating. A lot of phone calls were generated from that. We reach out to that. The second week has been more of the enforcement side. So the tip line, which I've posted for folks in the answer page, how to contact us to initiate a research or review or investigation on someone. And we've done a lot of those. My team, I've got about 4 people working continuously on this, and basically trying to get clarity around what's going on. There are a lot of people. I'm noticing tonight there are more people in town. I do know that there are some illegal rentals going on. We certainly know that, and we're working hard to get those sort of caught and shut down. The penalties are steep and they're difficult. So for if someone's caught renting, it's $1,000 fine for every night of the rental. So it's not a game. It's not it's something that we're not playing hard on. It's something that we're going all out with. So we're working very hard on that. Like I said, the first week was education. The second week is more the people that take a little bit more convincing. But what's at stake is, in addition to monetary, is possibility of losing the ability to rent at that location for an entire year. So we're extremely serious about it. The team's been working very hard on it. I think there's been a pretty good impact on it. I've heard a lot. Yeah, I'm noticing more people in town, and I don't know if they're second homeowners or if they're or if they're actually true renters. But yes, there are some people in town.
All right, thank you, Rob. Let's go to our next question.
Is there a plan to deal with vaccine distribution to the local community? If so, then any information would be appreciated.
Sure, I can certainly address that, and perhaps Dr. Boo and Dr. Burrows will want to add to it. But Mono County will be following the guidelines set by the CDC and the state. Basically, right now there's limited amount of vaccine, and we are in what's called phase 1, and more particular, we're in phase 1A. And basically, phase 1A is basically vaccinating hospital workers, those frontline workers, ER, ICU, EMTs, those individuals who are in direct contact with the public on a regular basis in a medical capacity. And phase 1B and 1C, they're actually revising that guidance, I believe this weekend, so there'll be more guidance coming out. But that will basically be more essential workers and people with certain comorbidities. Once we reach what's called phase 2, which will probably be hopefully by March, that is when more general public will be getting what the availability for the general public will be there, and we'll be having ongoing vaccination clinics. So there'll be more information as time goes on and we get more information in, and as we get more vaccine. So we're working on it and we're going to get there. Let's go ahead and go. Do we have any questions for Greg?
Yeah, we have a few.
All right, let's give Greg a few questions.
Great. Can you tell us if you're experiencing long-term symptoms as a result of your experience? If so, what are they and how are you feeling overall now? Would you say that you're 100%, 90%, 80%?
I'm probably about 90%. I really don't have a lot of long-term effects short of my lungs. I've been off the hill for 8 months, and coming back in, it's a little challenging, but I have a little scarring in my lungs. I will have 100% capacity within the next month or two, getting out there and skiing like I do. Unfortunately, excuse me, my dog's grabbing a toy. Oh, sorry about that. Unfortunately, I have my extremities have been a little compromised, where I have my left hand, I have half of my fingers on my left hand. My right hand, I'm under construction. So when I'm skiing, I'm holding one pole and I'm doing amazing. At the same time, being a skier, I'd like to have 2 poles in my hand. And, I have 3 surgeries left for my right hand, and to be fit on prosthetics. And the prosthetics I'm getting is the most amazing thing you could ever see. It's Terminator-ish, if you will. They're individual fingers. I'll be able to grab the pole. I'll be able to do everything I pretty much did in the past.
Great to
My
hear.
fingers are big old.
We have another Greg question.
Yeah. Thanks for sharing your story, Greg. I have 2 questions. Were some of the people in your group the same that upon returning to the US went to ski at Vail? Secondly, and this is a bit personal, so no need to answer, but do you know your blood type? My husband caught the virus while skiing at Vail, and our doctors have mentioned blood types coming into play. On a positive note, he survived and gave plasma yesterday. Remarkably, he's still carrying the antibodies. Prayers for your continued recovery.
So I'm an A positive blood type, which is known to be the worst blood type and the most extreme conditions that are out there. We don't know for a fact that it's blood type related. However, I do have the blood type that is the most extreme. Everybody, all 13 guys on the trip got COVID. And so Brett Leitner, who's sitting here with me today, is one of the guys that was on my trip, one of my best and dearest friends, and who's actually a homeowner here in Mammoth as well for 20 years. He got it very, very mildly. He was in the hospital for one night. But at the same time, and do you know your blood type?
I think I'm the whatever the neutral kind is. I don't
That's
know.
O. So he got it a lot. Everybody got it less than me, unfortunately.
Peter.
But at the end of the day, we're here to talk about it.
Thanks, Greg. Go
Greg,
ahead with,
oh,
I was going
Greg,
to say, go ahead with the next question.
Greg, do you know if you're totally immune to reinfection?
Nobody knows anything for sure. I actually was tested prior to coming on the Hill. I was tested for antibodies a week and a half prior to me coming up here. And the day before I came up here, obviously COVID negative. I still have the antibodies 8 months in. So what's interesting is Brett tested and he doesn't have the antibodies anymore.
I tested last week negative for the antibodies. I previously tested 5 times positive for the antibodies.
But 8 months in, I think kind of the way that they're talking about it based on your viral load, I had it as extreme as you ever can imagine. So I actually am positive for antibodies. Now, there's a test that's been provided that shows you the levels of where you have it now versus where you get it later on. And that I'm actually being tested for now. And we'll talk about how within the next 2 months, what's happening then. So whether or not it's diminishing or not.
All right. Do we have any more questions for Greg?
That's all we have for Greg at this time, but we can revisit him in a little bit.
All right. Do
Thank
we have
you.
anyone that's called in?
Sure, we have a call-in caller, Beta. Go ahead and unmute yourself.
Hi, Beta.
I didn't know I called in. I'm just, I'm a second homeowner that is following the rules. I'm sure Rob knows about me. I'm losing a lot of money. And I don't know, I hope you guys can do something. I mean, my rentals, I've canceled 2 or 3 already. They're all standing by for what's happening. And these are families from Orange County or LA. They're in Southern California. I don't really I don't understand what you guys are doing. I'm very, very upset, especially hearing about the film crew. I look at the cameras. This is a big part of my income. And I look at the cameras at the village and I see what's going on. I look at the lift lines at 7 in the morning to see what's happening. And this doesn't look good. It doesn't look like you guys are controlling it. Those people that abide by the rules are abiding it and doing it, and everybody else is doing whatever they want. And this is hurting the people that do abide by the rules. You guys need to do something else. Whatever it is you got to do is what you're doing now is not working. It's only affecting the people that are honest, that pay their taxes. And I don't know. I don't know what the solution is. I just know that I'm really upset, and I follow the guidelines to the T, but I can guarantee you, I mean, I'm getting bombarded left and right for rentals, and I keep saying, you know, hey, I've got the place blocked on Airbnb and VRBO. Don't give me a July date and expect me to give you a reservation for December. People are coming at you from all sides, but you know, at the same time, they're all from Southern California. Why can't Southern California people come and stay in like a week in Southern California? I don't understand that. It's
We lost Beta, I think. Oh, you're on mute, Beta.
yeah. The thing is, like, I've had a lot of health issues. I don't know what the emergency rooms look like because I'm not a doctor. But I've been in an ICU. I live in Orange County. I live next to Hoag. They only have 3 beds to start with in the Hoag in Irvine. Hoag Newport probably has 3 or 4 beds. So what is this percentage that everybody's like, you know, doing this crazy percentage numbers? I know there was only 3 beds to start with. I was one of the beds. I could see the other people around me. It was only 3. And Greg wants to say something. You're mad at me, Greg. No, I can't hear you.
But by no means am I mad at you. Absolutely not at all. We're all going through such amazing frustration, financial hardships. You know, I own a credit card processing company. I'm the merchant processor for the Mountain. This is directly affecting me as well financially. I was at St. Joe's Hospital right before I came up here, and I was in touch with the nurses there. And what's happening right now is they are so inundated with people in the ICU, and they're at a 2% vacancy rate where it's going out of control. And I don't have the answer for this. Nobody has the answer for this. You know, I feel for everybody and myself as well, economically speaking, because we're all hurting for this. You know, the problem is that people are not taking this seriously to get ahead of what responsibility we have as individuals. I wish I could have the answer. I mean, vaccines are coming out today. A lot of people are uncomfortable with the vaccines because it was quote unquote rapidly approved. You know, we have a major problem as a society right now in the United States, not just our individual community. We have to get ahead of this to do everything that it takes. And unfortunately, those people that aren't wearing a mask or aren't being socially distant, they're causing the biggest problem for all of us. And there's no answer to this currently because we're hurting. All of us are hurting. And I empathize with everybody that's fighting for their home, that's fighting with not having food on their plate. It's horrific. And somebody like me that survived this thing, you know, I get frustrated with the individuals that don't do what it takes to get ahead of this. We look at Australia. Australia has the most extreme concept of shutting it down overall. They give individuals $10,000 fines if they break the rules. We don't do that in the US. And these guys are getting ahead of it. We're not. So it's horrific. And by no means am I upset with you or anybody that's upset with the whole system. It's broken.
Thank you, Greg. Dr. Burrows, could you explain for Britta the ICU capacity percentage she was questioning? You're on mute, sir.
Apologies. I'm going to share my screen in a minute to try to graphically explain what's going on as well. But we are in the southern region, as I'm sure Britta and everyone else knows, and that includes all the hospitals in Southern California. The current ICU bed capacity right now is maxed out, which means there are 0 beds. So whether you have COVID or any other condition that requires the intensive care unit, there is no place to put you. If you look at Mono County and specifically Mammoth Hospital, well, I guess I'm going to say let's look at Mono County. We are extremely fortunate in the sense that the number of cases that we are seeing with respect to COVID infections is not translating into hospitalizations. The statewide average right now is about 12%. So that means if 100 people get sick with COVID, 12 of them have to go to the hospital. And then 12% of those, as Greg had talked about, have to go into the intensive care unit. All right, so let me try to show you this now. That is not coming. There we go. So this is kind of what we're looking at. If you look over on this screen right here, where we have, where we have a 12% hospitalization rate in 2 weeks. And then 12% of those patients are now getting admitted to the hospital. I don't know if everyone can see this. Is my pictures in the way? There we go. As we go along here from the end of December into January, towards the end of January, you can look over on this axis. If we don't do anything different, and if we catch up with the rest of the state and a lot of other parts of the country, we're going to see the hospital have upwards of 60 patients in the hospital and closing in on 20 patients in the intensive care unit. As we've talked about a number of times, our hospital is not typically equipped to handle that many people. Now, we have built a contingency plan to house upwards of 40 hot patients and potentially as many as 10 patients in the intensive care unit. Altitude is not the place to get sick with a respiratory infection. And with the resources we have and as isolated as we are geographically, this is not the place you want to get. You want to see how many people can get that sick. We can take care of a few people that are that sick, and typically our policy or our practice is to get them to a higher level of care, because those facilities have more beds, more staff, more resources, and they're better equipped to be able to handle those patients on a long-term basis. That has nothing to do with what I can do as an individual. You know, I'm trained in internal medicine, pulmonary medicine, and critical care medicine, but I'm only as good as my team and my equipment. And there's only so much that I can do on an individual basis with my knowledge base, knowing what we have and what we don't have. Now, compare that to the graph over here on the left side, and I think you can see my mouse moving around. If we maintain the level of infection and the percentage of people going into the hospital, then you can see by the end of January, as reflected in this blue line, we would still be much higher than we want to be, but we would be around 20 patients in the hospital and maybe a little more than 5 people in the intensive care unit. This is really what we're built to represent and what we're able to care for. So this is the data that we have. And again, we are extremely fortunate with respect to where we are and where we sit with how many people are getting infected and how many of those are turning into admissions. It is not a stretch to imagine, especially with what's going on in Nevada and Reno and Carson City and all the Southern California hospitals, that we could very quickly be in exactly that same predicament. And we are desperately trying to avoid that. I think Chief Freevault and I have spent an awful lot of time talking about this, and we have contemplated how to present this data. And I think it's fair for everyone listening to understand what we're looking at with very real numbers and projections, and not try to force our opinion on you and tell you this is what you have to do or else. I think this is the consideration everyone has to have in their head going forward with how to best act, as Greg talked about, and how to avoid this scenario from happening and try to keep it at least to this scenario, if not better.
And Dr. Burrows, those are just COVID patients. That's not counting anyone who would come in with a heart attack or any other kind of condition, correct?
That was the point that I made very early on. So when your intensive care unit capacity is at 100%, or I should say how many beds are taken up, if you have, and I don't want to wish this on anybody, but if you have a heart attack or you have kidney failure or you have what's called sepsis, where an infection overtakes all the organs in your system, there's no place for you to go, because the intensive care unit is full with everything, including COVID patients.
Right.
So all the more reason that we need to preserve the resources we have to take care of absolutely everybody, not just COVID. The idea that it's just going to be a mild illness and no big deal. I mean, look around the rest of the state, look around the rest of the country. The intensive care beds are being tied up all over the place. And that is not going to get better on its own. That is going to be a conscious decision on the part of absolutely everybody listening to this and listening to the news and partaking in life in general as to how this is going to go. I mean, this is from a healthcare perspective, this is really scary. I have a number of colleagues and friends in different parts of the country and the state. They're getting slammed with patients coming in. And I can tell you firsthand that patients that are going to the intensive care unit, with the exception of Greg, and I'm happy you're here listening to this, they go to the intensive care unit and they die. And we are desperately trying to avoid that. The last thing I want to do is have our hospital have to pull out our ethics policies and decide, what are we going to do about this person? Because we just don't have a ventilator to put them on. Who gets this one? Those are nightmarish decisions to have to make.
Craig, it's really interesting that you said that. Given what they call me personally, given a 1% chance of survival, 12% of the people that are infected get into the ICU. 1% is severe, and I'm the 1% of the 1% that's severe that survived, which dilutes even my 1%. And I'm in contact with my nurses at St. Joe's, and I'll read you a text right now that I got yesterday that says, we have travel nurses coming in to help. She worked 90-something hours last week alone. No more CRRT machines. All floors are full. I think our ER was closed the other day. This is in LA, and this is a large enough hospital that has been maxed out, and it's extremely extreme. So our small community here in Mammoth Lakes, the fact that we're not impacted immediately by severity is amazing, and we need to keep it that way, which we have to understand. We need to all take it individually to say, do not congregate on holidays and wear the mask, stay socially distant, and do what it takes to keep us open.
Thanks, Greg. Thanks, Dr. Burrows. I believe Chief Freevault wanted to add to that. Go ahead.
Just quickly, Dr. Burrows and Stu explained the hospital situation in the region that we're at, being at 0, and they do count those in in decimal points. It was 0.5, 1.7 for days, so I think the 0 is exactly that. Also, because most of our transports would go to Northern Nevada, I'm in touch with the EOC daily there and get a readout from them as far as what their capacities are. And the challenge I think a lot of hospitals are seeing is that you can even conceivably have some beds open or some equipment, but it's staffing shortages as well. It's kind of an issue. So the place that we would normally go is stretched. If any of you get the Nevada news in the evening, you can listen yourselves as far as what their status is. And I think to complement what Dr. Burrows said, all we're trying to do, especially tonight, or if you call, or if you have questions in the chat box, we're just trying to give you the information that we have. We are all going to have decisions to make. We're making them every day. We have decisions coming up in the future. A lot of them are going to be difficult. This isn't about trying to put anything out of proportion. We're trying to give you the same information that we have, and the community's shown the ability to make tough decisions and get this far. We did it through the summer and made it. We're close, as Greg said, and you heard from Brian. We have some vaccines coming. We just have to be so careful right now because there's very little margin for error, as you saw from Dr. Burrows. If we can do what we've been doing, it's kind of within our scope. We've prepped for that. If we just don't quite do what's necessary, the numbers shoot right past us and we have no place to send you. So thank you for your patience.
Thank you, Chief Freevault. Well, we got about 10 minutes left. Let's see if we can get through some of these questions in the queue. So what's our next question?
Can you help clarify the rules of the stay-at-home order and why there's so many tourists in town right now? Also, why does Mammoth Lakes have a lodging order when it's part of the Southern California region?
Dr. Boo, do you want to take part of that question?
Sure. Hi, everyone. Tom Boo, County Health Officer. Throughout this pandemic, enforcement or compliance, a lot of people in our divided society have chosen not to follow the public health recommendations and orders, and many people are choosing not to stay at home just because in spite of the fact that the governor and the state health department have directed people to do so. And it's not like CHP is out there stopping people or anything like that. What was the other part of the question? I'm sorry.
Why does Mono County or Mammoth Lakes have a lodging
Yeah.
order when it's part of the Southern California region?
Yeah, okay. So it's countywide. It's not the town of Mammoth Lakes, and it's because when the state put out the regional stay-at-home order, it wasn't very clear exactly what they meant by their lodging restrictions and aspects of their stay-at-home order. And we felt we knew from conference calls with the state what their intent was, but the language of the order was not clear. It's since been made clear. They've gone to some effort to clarify that and other aspects of the order that were pretty muddy, but we thought that we needed a very clear, simple order.
All right, thank you, Dr. Boo. Let's go ahead and go to our next question.
Recognizing that no one can predict the future, what are the odds that the town of Mammoth Lakes will open on December 27th? And if town won't open, when is it likely to happen?
Dr. Boo, do you want to take that one too?
Yeah. So I don't have a crystal ball, but the fact that we've not yet seen any improvement, and we've only seen worsening in the ICU situation in our region to date, doesn't make me optimistic that in 9 or 10 days we'll be at that 15% level or better.
Thank you, Dr. Boo. I believe Chief Freevolt would like to share something with us. Go ahead, Chief.
Just real quick, do the share screen here. Brian, can you see that?
Yes, we see it.
So as we approach this possibility of a stay-at-home order, the state started putting out the ICU capacity in the region we're in, Southern California region. And this is the trend since about the 5th of December. And so you can see it took us about 12 days to go from a little bit above 15% down to where we are today at 0. As with Dr. Boo, I don't have a crystal ball. But the number of hospitals, I don't have, but the number of hospitals in Southern California because of its density is significant. And it took a while to drive those numbers down, and it'll take a while to drive those numbers up. But you can check those daily on the website that Stu gave you. But can't tell you what's going to happen in the future, but that's what roughly the last 12 days look like. Thank you, Brian.
All right, thank you, Chief. Let's take a call in.
Okay, Cleland, go ahead and unmute yourself.
Hi, Cleland. How are you tonight?
I know I'm recently off town council, but I do have a couple of questions for everyone. Number one, the thing about productions is a very valid question. I have had a company for almost 20 years dealing with productions. They are bringing people from out of town into town where they could use local people to do some things. So that is something that is not essential. Commercials are not essential. Mammoth Mountain can turn a permit around in 3 days. if you're going to be shooting because they have the Forest Service permit, any other company coming up, that is an issue. Another thing I have also posted that I'm going to just call you guys out right now. Number one, we have a police chief who is not into people wearing masks. He is not a supporter of that kind of attitude. I believe that is a problem. I have been calling people, I haven't been getting answers. And my other issue would have to be with the hospital. Someone went into the emergency room last week. It was something that needed to be dealt with. They were alone, no friends, no family. And then all of a sudden, there was a snowboarder or a skier who had a minor injury. And in the ER, there were 5, actually, the person said 8 people, but I'm going down going, there's no way. This is not acceptable. Mammoth Lakes is not following protocol. I'm currently down in LA. LA people are doing everything to the best of their ability to keep everybody safe. I am just really wondering what right now. I have a variety of questions, and I know we're getting to the end of the meeting, but I'm not going to give this up. Greg, God bless you for having to go through this and tell your story. But there are so many people in Mammoth Lakes who think it is just a fallacy, and the people are not stepping up to make the changes that need to happen. And frankly, the Mammoth Mountain being open is the biggest farce I have ever seen on the face of the earth, because we have so many people coming up and they may be doing fine in their hometowns. They come to Mammoth and all rules are going out the window. So just whoever wants to speak on this, but it is production is not essential. That is not essential. And if it is essential, then they should be using locals to have this done and not affiliated with just the powers that be. So I know that was a lot, but number one, the ER, why were 6 to 8 people allowed in the ER when there was another single person being treated, a longtime local, allowed to just be, just walking around and visiting with someone?
Go ahead, Ingrid. I see you have your mic off.
Yeah. So I understand Cleveland's frustration. I took my husband to the hospital last week for a surgery. I dropped him off outside. When he was done, I picked him up outside. I've taken him to PT a couple of times. I have not been inside the hospital. I get it. It's frustrating. I don't know what the exception was. Maybe Craig can answer. Maybe he can't. He wasn't there. Things happen. We can't be everywhere at all times. It's like when you're driving on the highway at 55 miles per hour, doing the speed limit, and everybody's speeding around you, and it's frustrating. But we're doing everything that we can, Cleveland, and I get that you're frustrated, but this isn't the way to go about it. We need to be patient with each other. We need to be kind. We need to do the best that we can. And everybody on this panel is doing the best that they can. We really are. And we are not going to catch every homeowner that's allowing a friend to stay at their house. We're not going to catch every person that's wearing a mask in Vaughn's. We're not going to catch every person that comes too close to you at the mountain. We're trying. Everybody is trying. We're all trying to do our best. And that's all we can do is keep moving forward, keep doing the best that we can do, and expect others to do it as well.
Thank you, Ingrid. Why don't we go ahead and go to our next question?
Sorry. Will the vaccine be free to the public? And what is the latest info on whether a person can still transmit COVID even after vaccination?
The vaccination is absolutely free. There will be no charge. And what was the second part of the question again?
What is the current information on transmission after vaccination?
Dr.
Do
Boo,
you want me
can
to
you
take that?
field that one?
Sure. Tom Boo again. That is a key unanswered question that has not been studied. There are efforts to study that right now, and there's been discussion also that a lot of California hospitals have just in the last couple of weeks started more routinely testing their staff, and these same staff are going to be the first vaccine recipients in the state, and so continuing to test staff for to find out whether there is asymptomatic infection and transmission will be very important. When we think about what impact this vaccine may have in really ending the epidemic, its ability to prevent asymptomatic infection and transmission is very important. It's a major unanswered question right now. It's very good at preventing illness and severe illness, both the Pfizer vaccine and the Moderna vaccine. It'll do great things for keeping people well and keeping the hospitals functioning as more of it gets out there and into the arms of people in California and around the world. But we do not know how good it is at preventing transmission.
Thank you, Dr. Boo. It is 6:32. We still have a fair amount of questions in the queue. Is it all right if we stick around just for a couple more questions? We okay with that? All right, let's go to our next question then. Thank you so much, panel.
Have any cases been directly connected to lodging or dining by guests?
Can you repeat that?
Have any cases been directly connected to lodging or dining by a guest?
Not that we're aware of, I think, Dr. Boo. Is that correct? I don't think
Well, we have had some cases where there seem to be, it's when our contact tracing staff are talking to people who have tested positive, who have COVID, you're never able to prove where someone got infected, but there have been a number of cases where the only possible exposure that was identified by the person was in local restaurants. There've been a handful of those. Lodging, I'm not sure about. We've seen a number of cases in the staff of lodging establishments, but again, it's always impossible to prove where an infection occurred. It's an invisible event, and the incubation period is variable. So.
Thank you, Dr. Boo. Go ahead, Dr. Burrows.
Yeah, I was going to say that's almost an impossible question to answer, but I think looking at it another way, certainly our experience has been that when an individual becomes infected, and certainly the ones that we've seen that become symptomatic, it's almost a given that everyone that they've been in close contact with is also going to be positive. And there'll be varying degrees of how sick they are, depending on their age and other conditions that they may have. But the concern is obviously it is highly contagious. So if you have it and you're not isolating or keeping away from other people, boy, there's an outstanding chance you're going to give it to other people. And that's just what we've seen. And so I don't know. I actually don't know how important it is to say, well, it's someone from the restaurant or lodging. It's more if you were in contact with someone that tested positive for any period of time, there is an outstanding chance that you have it as well.
Thank you, Dr. Burrows. Let's go ahead and take another question.
We live here full time. My wife has 4th stage kidney failure. We're both in our mid-60s and are taking this very seriously. There are tourists who shop at Bonds with masks below their chins and renters in our complex. What can we do? Is there anyone who can intervene?
Rob?
Mute here. Sorry about that. It's on mute. Yeah, I've talked to Bonds a couple of times. Some of you may have seen some folks that are now stationed by the door. They're supposed to be, talking to folks about having face coverings when they do come in. And we also had a stint of time there where Bonds was queuing people outside. That was based upon sort of a miscommunication around the number of people they were allowed to have in the store at one time. Their corporate offices had given them a smaller number. That was the actual net number they were supposed to target, and they took, rates off of that, and so they had a very small number. But just kind of wanting to explain that, I've heard a lot of questions that come out with that. The challenge with confronting people about having those things, it's not something that staff within Bonds is going to really be able to do. I think the challenge we have, and we've got folks out there that are trying to challenge it from not wearing masks in general or just wearing them inappropriately. I have had just general conversations with people, education, I've noticed, said things like that. That's helpful for them to kind of remind them that, oh, I don't have it on. But in general, we're going to find people that are not in compliance. And I think, and I won't speak for the law enforcement folks, but arresting someone for not wearing a mask or having some other challenges like that, it's really an educational piece and looking for compliance. And we really only have authority within certain areas. So, meaning inside buildings and such. I don't think that was
but Rob, the other part of the question was about apparently illicit rentals in their condominium complex. Could you comment on that too? Because I believe you guys do respond to specific complaints, but they have to be specific.
Oh, absolutely. I'm sorry, I didn't pick that up. So we have an enforcement task force, and I've been posting lots of notes in the live chat here, just on how to contact us and reach out to us. And when you talk about specifics, I really do need to know, what's the address of the place? And we will look that up. I've got access to all the tax rolls to know where, who's paying the taxes on that, how to contact them. And I've had several phone calls with folks that are on that. So we chase them down, all the leads down till the end of them. And so I would appreciate that information, but you have to provide specifics. You can't just say, well, there's a lot of tourists in town and what are you guys doing? It's more like, I know this house, go check it out, and we'll be all over it. So thank you.
Thank you, Rob. I believe, Greg, you had your hand up.
I'll take a pass on this one.
Okay.
It got way past me at this point on that whole passionate thing.
Thanks, Greg. Hey, so our IT department has just shared that for people who are concerned about shopping and their vulnerability, Bonds is offering special shopping from 6 a.m. to 7 a.m. Monday through Friday, and that's supposed to be a time when the general public does not shop, but that people who may be older or medically vulnerable in some way can shop and feel safer. I believe all retail that are open in California are supposed to be offering the same kind of special hours right now.
Thank you, Dr. Boo. That's good information. And it's about time we need to wrap up. Greg, I want to thank you so much for being with us. It's an amazing story. Welcome back to Mammoth.
Thank you very much.
Yeah, thanks, Greg. You look really healthy.
Feeling good, man.
All right. Other than that, thanks to all my panelists. Thanks to the viewers. And until we see each other again, take care of each other. Good night, Mono County.
Thanks for having me, everybody.
Thanks again, Greg.